Next, I would like to introduce to you Dr. Marie Hilliard, who is Director of the National Bioethics and Public Policy for the National Catholic Bioethics Center in Philadelphia, Pennsylvania. I have the privilege of working with Dr. Hilliard in Washington, where we meet quarterly to determine, different projects that we can work together on with numerous groups in Washington and actually take that ideas that we have in Washington and bring them back to each and every state. Dr. Hilliard holds graduate degrees in maternal child health nursing, religious studies, canon law, and professional higher education administration. Former tenured division chair in Catholic higher education. Again, just want to reinforce, the whole idea of education and how we all know there's so much more education that's got to take place in the healthcare arena. She has an extensive professional background in medical ethics and public policy and advocacy, having served as director of the Connecticut Catholic Conference. She is a registered nurse who has been substantially involved in healthcare regulation at the state and national levels for 12 years. She is former executive officer of the Connecticut Board of Examiners for Nursing and National Council of State Boards of Nursing. In addition, Dr. Hilliard is a canon lawyer and serves as a resource for the United States bishops on the implementation of the ethical and religious directives of Catholic healthcare services, as well as church-state relations. Please give a warm welcome to Marie Hilliard. Dr. Marie Hilliard.
I want to thank Mike for that very nice introduction, but also for all that's been done for us to be here. It's very, very fulfilling for me, and I'm sure for each of you. We go back to our own areas of work, ministry, really, and sometimes I think we can feel very much alone. And this is just very, very rewarding, I think, for all of us to be here. So we're very grateful to all of our sponsors. Christus Medicus, of course, has been in contact with me early on, but we work with the Catholic Medical Association. I know the Detroit Guild is our co-sponsor here, but their national headquarters is located right in Philadelphia, where my office is. So, and also One More Soul, which I got to learn a little bit more about yesterday. And then we have our wonderful local hosts here, this wonderful hospital, and as His Excellency Bishop Vasa set the stage for much of what I want to say in terms of the importance of faith-based ministries and the Catholic Church. And this, I don't know if you saw as we pulled in today, Top 100 Hospital in front of the building posted for this facility, but it's so true of Catholic healthcare throughout the country. We're the best. We're not just the largest. We're the best. And it is a ministry. And as Bishop Vasa pointed out, they're trying to turn us into agents of the state. And we also have a host in the Michigan Catholic Conference. It's so good for me to see Paul Long. I was a state Catholic Conference director for 10 years in Connecticut, and believe me, it's no small task. No small task at all. So I'm very honored to be here with our presenters and also the panelists. And the person who's going to follow me has pulled together, this is Bill Saunders from your program, has pulled together a coalition of agencies working on conscience protection. And they do meet in Washington. I represent the National Catholic Bioethics Center where I work in Philadelphia. But these are very, very dangerous times. If anyone ever told me when I went to nursing school I went first to the Children's Hospital in Boston for my RN, and I was able there when we were affiliating at Brigham and Women's, which in those days was Boston Lying In and Peter and Brigham, when they wanted me to go into a room in which they were inserting an IUD, and I refused as a 19-year-old scared young student. But I'm not sure that could happen today. And we get these same phone calls that Richard Dorflinger spoke about. We have a 24/7 consult line at the National Catholic Bioethics Center. By the way, if you ever need to use it, There's a doctorally prepared bioethicist on call, and we get about 1,400 calls per year, and I coordinate that. And increasingly, we're getting calls from folks who are interested in going to healthcare or in healthcare, asking, can I go into healthcare because of what we're just hearing about in terms of the mandate. So these are very, very difficult times and significant threats to our conscience rights. And often it's couched in this, that we're violating the First Amendment of the United States Constitution, when it's just the opposite. Two prongs of the First Amendment, one being that there'll be no established religion. And the second is there will be free exercise of religion. But whenever we in healthcare are trying to exercise that right, we are accused of violating the separation of church and state. And actually, there's nothing further from the truth, because the new established religion is secular relativism in this country. And when we, again, try to assert our rights, we're considered violating that very First Amendment that's there to protect us. It's interesting, for 10 years I was the State Catholic Conference Director, and Paul Long, who's going to be on the panel, probably can attest to this. When I was flying to different national meetings, and you'd be sitting next to someone and they'd ask you what you did. And what's the State Catholic Conference Director? Well, in Connecticut, I had to be a registered lobbyist. That was the law. And as soon as I said that, people would say, oh, that's a violation of the separation of church and state. Nothing could be further from the truth. But there's a great constitutional lawyer, Stephen Carter. You might have heard of him, he's a law professor at Yale, not a Catholic, and he's written a book called The Culture of Disbelief. And in it, I'm going to just give a brief quote. He talks about this movement, this secularization of our society that is a threat to persons of faith. And he talks about this in relationship to the First Amendment, and I'm going to quote here. For the most significant aspect of the separation of church and state is not, as some seem to think, the shielding of the secular world from too strong a religious influence. The principal task of the separation of church and state is to secure religious freedom. But unfortunately, just the opposite is happening. Those of us in healthcare are now considered agents of the state because we hold licenses, or the facility is licensed, and therefore we're no longer a ministry, and we must conform to violations of human life that are mandated by government. And it's very tragic, because the very government, born out of a need for freedom, that's why folks came to this great land, particularly religious freedom, the very government born out of that need is not only saying that human life is not going to be protected, but wants to discriminate against those of us who are trying to protect human life. Very, very disconcerting times. We've heard about PACA, the healthcare reform bill that Richard just spoke about. And tied to that, some of the concerns within that particular legislation, tied to that is the recent rescinding by President Obama of major provisions of the conscience rule that was promulgated under President Bush. So if we look at what's happening hand in hand in terms of what's happening at the federal level, and my focus will be more at the state level, but they go in hand. If you look at the mandates that have been laid out already by Richard, especially in terms of the funding issue, but non-protection of conscience except for some small areas that I'll speak about. Then the erosion of the conscience rule, and then what's happening at the state level, which you all now have handouts. I keep track of all the bad news, which you have in those charts that I've just handed out. It has a significant impact on our ability to serve human life, which is why we all went into healthcare. You know, when I was a dean of a school of nursing, a division director, I remember interviewing students, and so many times you're interviewing young folks who want to go into healthcare, you'd hear, I want to take care of people. You know, we all went in with an altruistic motive, and again, protecting human life, human dignity. And we're being challenged now in our ability to do that. I want to talk about and build upon what Bishop Bassa mentioned in his homily, particularly, and then in his opening remarks, about this move to treat us as agents of the state and not ministry. And if we look at the statistics in terms of Catholic health care in this country and the number of people that are served by Catholic health care, it is phenomenal. There are 561 Catholic hospitals in the United States treating annually 86.5 million patients. Phenomenal. And added to that, there are other types of agencies, surgery centers, clinics, long-term care, 2,331 of those, treating almost 8 million persons annually. But the significant point is we're not only the largest provider of non-governmental health care and human services, it's not the Red Cross, it's our Catholic charities, our Catholic social services, as well as education. But we're not only the largest, we're the oldest. I was in the military, Army Reserves, for 20 years, and I ran all their medical and nursing education in the northeastern United States. And in all the secular textbooks that my students were reading in those programs, it cites the history of healthcare being tied to the ministry of the Catholic Church, not the language they use. But if you look to Benedict in 500 AD, the textbooks talk about the first organized nursing being the Benedictines. The hospitalers, any of you Malta? I know I met some of you. Yeah, I'm Malta also. And 1113, cited in the textbooks, the hospitalers, the first form of organized healthcare in the world, the Catholic Church. And if you look in this country, in terms of the first hospital west of the Mississippi, Elizabeth Seton Sisters, 1831 in St. Louis, the first hospital west of the Mississippi. This old and historic institution, the sisters that came west in the late 1800s, you know, you think about just trying to get here. And I was speaking in a hospital in North Dakota, and I'm thinking about the weather, and those young women that went there to found ministries, not agents of the state. And clearly, the government is treating our ministries as if we are licensed agents of the state. And if you just look at oppressive regimes, where does this lead us? The Nuremberg trials, in the long run, if we just if what is legal now becomes ethical, we're back to people who just follow the rules are never going to advocate for patients. Never. It's very dangerous. Even from a secular perspective, very dangerous. And it is undeniable, despite all the claims to the contrary, that PACA, the Healthcare Reform Law, not only funds programs that will provide abortion, but it also has three actually, plans that will have direct funding, if you follow the letter of the law, for abortion on demand. That's the community health centers. There was $11 billion in this legislation for that. That it's not even a separate check that a subscriber to a health plan has to write for that service, quote unquote, every month. It would be a direct pay, cooperative grants, and the high-risk pools. And we saw where, actually in Pennsylvania, where I'm from, where the high-risk pool proposal was sent to government, including abortion. It was signed as approved until the outcry came, wait a minute, you said there was going to be no direct pay for abortion. Because President Obama signed this executive order, which he is not able to legislate, he's only able to administer the law. And I just want to read to you the second to last paragraph of this executive order that's to assure us that we're not funding abortion. This is the last paragraph, the second to last, I think. This order is not intended to, and does not, create any right or benefit, substantive or procedural, enforceable at law, or in equity by any party against the United States. The administrative branch, the executive branch, isn't able to create new law. PACA has been passed. And therefore, truly, if push came to shove in terms of the provisions in the high-risk pools, etc., the law says there can be direct funding. And then you tie this with what Richard has mentioned, the essential health benefits that are to be in every region of the country. And if we look at cases that have been to the Supreme Court in terms of Medicaid and what is meant by an essential health benefit, I'm going to quote from a Supreme Court case. Abortion fits within many of the mandatory categories, including family planning, outpatient services, inpatient services, and physicians' benefits. And because of that, the Hyde Amendment was necessary in terms of any appropriations bill from Congress to be included to make sure that public funding wasn't used for abortion. And every meaningful attempt in PACA to have a Hyde Amendment included, as Richard pointed out, was opposed, not included. There are two provisions that protect conscience in PACA. One is in relationship to abortion, and Richard just spoke to that with its limitations, and the other is for participating in assisted suicide. The problem is in the definition of terms when you get to the state level. And I'll give you some examples. You do probably recall, those of us who have been around for a while, that there was a change in definition by the professional associations in terms of what conception is meant to mean, what conception means. Historically and scientifically, conception is the moment of fertilization. No question. That's the moment. But professional associations like ACOG changed the definition to mean implantation, so that when we have a provision that's going to protect conscience in terms of abortion, abortion includes abortifacients, but protection of persons of conscience like me, that young student nurse who didn't want to go into the room where an IUD was being inserted, that protection is not included. The same would be true if we look at the definition of assisted suicide in the states in which it has been legalized. We have a court decision in Montana that basically says it's not against the law for the physician to assist in an assisted suicide, but it doesn't make it legal in the way that Oregon and Washington did. But in the states of Oregon and Washington, specifically in the law and in the regulations that implement the law, and on the cause of death, on the death certificate, one cannot list assisted suicide as the cause of death. One has to list the underlying pathology. And specifically, Oregon law states that the Oregon Death with Dignity Act does not constitute suicide, mercy killing, or homicide under the law. So you see, when you have these supposed carve-outs that are going to protect conscience, but then you would get to the definition of conscience, especially as it impacts at the state level, it's tenuous at best. And without the Hyde-Weldon Amendment that Richard Dorflinger spoke of, that is attached to every particular appropriations bill, and of course you mentioned the attempted fixes of this in 4 pieces of legislation. We are really at the mercy of these mandates, or potentially will be. And then again, if we look at the conscience rule that President Obama had promulgated just before he left office, it was clearly more in sync with the true meaning of the Church Amendment. President Bush's conscience protection rule basically said any medical procedure or research, which would be much more consistent with the Church Amendment. But President Obama, in rescinding major portions of the rule, has limited it to sterilizations and abortion, surgical sterilizations and abortion. Again, we get into the problem with definition of terms. So the impact on all of us as healthcare providers is significant, but where it becomes increasingly significant is in regions of the country where Catholic healthcare is the chief provider. And as further west you go, that's very, very evident. And I did a presentation in Oklahoma, and it was interesting. Most of the population being served, vast majority was not Catholic. Majority of healthcare in this region was all provided as a ministry of the Catholic Church. And clearly, it's not just the right to life, therefore, that's in jeopardy, but it's the right of those of us who are trying to protect life, to try to provide human life and human dignity with respect of natural moral law. We don't even have to use church speak. It's consistent with natural moral law. We are clearly in jeopardy. Right now, I'm going to go through some examples, and Richard talked of some that I call it my bad news speech, but how this is actually being acted out at the state-by-state level. Right now, before the state of New York and their New York Assembly is a bill that has been brought back from last year's Reproductive Health Act. And that act basically states that abortion is a right, and no entity, including faith-based entities, can refuse to provide abortion. There is very limited protection for individuals. Providers don't have to participate in abortion or provide abortion. The participation is less strong because there's no protection for those who might not want to refer for one or counsel for one, or provide insurance coverage for it. So that is alive and well in terms of the New York State Assembly. Richard took a few slaps, I guess, at California, and I'm going to continue to go there in terms of some of the laws and court decisions that are really heralding what we may be facing state by state as this mentality of Catholic health care just being, I love that term about us being high-class veterinarians, those of us in healthcare. Actually, I use another phrase in terms of we're the persons who serve automobiles, service automobiles. You come and tell us what you want, and we're supposed to provide it, regardless of our particular understanding of natural moral law. In California, a Catholic hospital was sued for initially refusing to do breast augmentation surgery on a person undergoing transgendering surgery. The court ordered a fertility practice that was really evangelically based in California that only wanted to provide, it was IVF, but they only wanted to provide it to married couples, and lesbians presented themselves. And the court ordered them in California to provide such a quote-unquote service to any person who requested it. They could not determine that perhaps children are best in a home raised with a mother and a father, which we know to be true. It took 4 years. In another instance, this was a nurse in New Orleans who refused to administer the morning after pill, emergency contraception, and she lost her full-time job. And it took 4 years for her to get justice in terms of that refusal. 19 states, and you have the chart, have legal mandates for the administration of emergency contraception, which can also function as an abortifacient under sexual assault protocols. Now, there are certain times where we do appropriate testing where we can stop ovulation, but state upon state are not allowing us to even do a good workup in terms of where a woman is in her cycle before we administer it. We already heard about Nurse DiCarlo in New York. She gave all the appropriate notice before, even on hiring, by the way, that she would not participate in an abortion. They threatened her in a way that they said they were going to the state nursing board and threaten her license if she would not participate. And it wasn't, we teach bioethics at Catholic University, and we gave this as a case study, and the students did a great workup. And they had other interventions in terms of it sounded like preeclampsia, toxemia of pregnancy. Had they been utilized, they were 22 weeks or 22 weeks short of viability. And also, there was a 6-hour window where another person could have been found. And again, her license was threatened for if she refused to assist in it. And again, we heard about the court decided she had no private right of action after that occurred. Our professional associations that are supposed to not just protect their patients, but also our professional practices, ACOG has stated that conscience can only be accommodated after the needs of the patients are met. And specifically, it talks about physicians of conscience having to refer to other providers for morally illicit procedures, but it even goes further than that. It says in resource-sparse areas, physicians of conscience must locate their practices near persons who will do what we won't do. And in an emergency, we'll have to do it anyway. This is our professional association, at least ACOG, which is there not just to protect the patients, but also the professionals. There is some good news. I was really happy to hear this. There were 8 nurses in Long Island at Nassau University Medical Center that went to their union and said, look, we don't want to participate in abortion. You've got to back us up here. And the union did. And that was really encouraging, another route to go. Yet, when pregnancy crisis centers, you can call them crisis centers, pregnancy help centers, who are there to provide alternatives for abortion, try to do so. You've probably been following the cases. In Baltimore, the city council said they must post signs. They call it mandated government speech. It would be like saying a hospital that doesn't do heart transplants, a lot of them don't, have to post signs of what we don't do or do not perform. These crisis pregnancy centers were told what they had to post, and interestingly enough, the Archdiocese of Baltimore brought suit, and they have won at the lower court level. It's being challenged. But the same ordinance was signed into law in New York City, and it's before the Washington legislature. It'll be interesting to see how this all gets played out in court. But here, we're trying to provide alternatives, and we're being slapped down. Very disconcerting to me was the statement by the American Medical Association trustees, and they issued a statement, and I'm going to read a quote from it. Our AMA supports legislation that would require individual pharmacists and pharmacy chains to fill legally valid prescriptions or to provide immediate referral to an appropriate alternative dispensing pharmacy without interference. This is very difficult, especially when you have one pharmacist on duty and he doesn't want to refer. Transferring the care is another matter. And only 9 of the 25 states with pharmacy mandates have any type of true conscience protection. And 5 of these 25 states have laws that say that a pharmacist must fill every legally valid prescription. And one of those states is the state of Washington, where assisted suicide is legal. And then there is the Religious Coalition for Reproductive Choice. These are religious leaders, and they admonish that the law should not be overridden by positions of conscience that are based on religious beliefs. These are religious leaders that have joined a coalition and made that statement. And this has never been seen more blatantly in 2 states, the state of California again, and the state of New York, where both state legislatures, and it's been to the highest court in both states, have stated that Catholic charities, Catholic hospitals, and other institutions must provide health plans if they provide prescriptive coverage. The only access they will have to health plans are health plans that include contraceptives and abortifacients. And when the church, there is a religious exemption in both of those states, but the church has said that you do not, the government has said that you do not qualify for religious exemption unless you only hire primarily those of your own faith, you only serve primarily those of your own faith, and you proselytize. That would mean this wonderful hospital here in the emergency room would have to check for baptismal certificates, not just the insurance card, as people get admitted to their emergency room. And if we did that, can you imagine what the government would say? You're checking for baptismal certificates? But that's what and it went to the Supreme Court of this country, and they refused to hear the challenge to that. And like Richard, I'm citing Thomas Jefferson. Another quote, I thought, Richard, you were going to have the same one, and I was a little nervous. But Thomas Jefferson said, our rules can have authority over such natural rights only as we have submitted to them. The rights of conscience we never submitted. We could not submit. We are answerable for them to our God. And if you allow me just to take one more minute, and I'm going to quote from our Holy Father, Benedict, who in his recent visit to the United Kingdom, Westminster Hall, he addressed the government representatives there on the proper place of religious belief in the political process. And he was speaking about the integrity of St. Thomas More and his convictions of conscience, even to the point of death. And he spoke about the perennial question of the relationship between what is owed to Caesar and what is owed to God. And I'm going to quote, if you'll allow me. Each generation, as it seeks to advance the common good, must ask anew, what are the requirements that governments may reasonably impose on citizens, and how far do they extend? He continued, I cannot but voice my concern at the increasing marginalization of religion, particularly of Christianity, that is taking place in some quarters, even in nations which place a great emphasis on tolerance. There are those who would advocate that the voice of religion be silenced, or at least relegated to the purely private sphere. And there are those who argue, paradoxically, with the intention of eliminating discrimination, that Christians in public roles should be required at times to act against their conscience. These are worrying signs of a failure to appreciate not only the rights of believers to freedom of conscience and freedom of religion, but also the legitimate role of religion in the public square. And clearly, as Stephen Carter, who I started with my first quote, is right on when he says the potential transformation, this is me quoting Stephen Carter now, the potential transformation of the Establishment Clause from the guardian of religious freedom into guarantor of public secularism rises prospects at once dismal and dreadful. Thank you very much.